Time is an indispensable component of any relationship. This is particularly true for the relationship between a patient and their doctor. Unfortunately, Americans have seen the time spent with their doctors decline. It is now estimated to be 5.2 minutes per visit. In contrast, many other industries have recognized the value of time and have found ways to use technology to optimize it for the benefit of their customers. My name is Dr. Ephraim Makuve, and as a physical therapist, I have experienced it firsthand. Time allows me to provide my patients with accurate diagnosis and personalized treatment plans. And that's why I founded Hutano, to bring time back to the patient-provider relationship. When I embarked on this journey 3 years ago, I was advised to tackle healthcare one piece at a time, as it was deemed too complex for any one company to solve entirely. However, I beg to differ. The truth is that healthcare is straightforward. That's why Hutano's first order of business was to define precisely what healthcare access entails. We boiled it down to 5 fundamental steps that every healthcare journey must include. The 5 steps are finding healthcare providers, scheduling appointments, completing paperwork, documenting, and managing follow-up care. The first step, finding healthcare, could be more efficient. Typically, patients have had to do with using search engines and social media recommendations. Often, information from these sources is outdated or incomplete. On Hutano, patients can search for providers by name, specialty, insurance, reputation rating, or distance from their home. In seconds, they will know if the provider takes their insurance and how much they will charge out of pocket. Next, booking appointments remains a significant challenge, primarily due to the reliance on analog technologies like phones and faxes. Additionally, rescheduling or canceling appointments is equally frustrating and inefficient. To address this challenge, Hutano gives patients complete control. With Hutano, patients can self-schedule appointments, select the date, time, location, and type of service they need and how they want the service delivered, on-site, virtually, or in a clinic. Next, filling out paperwork. It's often redundant and frustrating for patients and providers. For example, if you've been to a doctor recently, you likely spent at least 15 minutes filling out paperwork. Hutano simplifies the intake process, starting from the patient onboarding stage. For example, information collected during onboarding, such as date of birth and gender, typically doesn't change over time. So patients enter it once, and Hutano automatically populates it wherever it's required throughout the healthcare journey. On Hutano, patients complete the online paperwork using the Hutano app, allowing healthcare providers to review the documents hours before the treatment appointment. After treatment, healthcare providers must document the encounter, and healthcare providers know all too well the pain point of documentation. On average, doctors in the U.S. spend around 16 minutes writing about each patient encounter. That's about 3 times the 5.2 minutes they spend with each patient. To address this problem, Hutano transfers the intake information from the patient into the provider's documentation, which alone saves at least 15% in documentation time. In addition, our documentation engine automatically converts patient intake into a readable, medically sound, and legally compliant document. To streamline documentation further, Hutano asks the provider for 3 essential details about each examination finding: the clinical concern, how the provider will treat the condition, and the medical diagnosis. This straightforward approach to documentation saves an additional 15 to 20% in documentation time. Yet, the result is a concise medical record showing the results of a medical test, the clinician's concerns, how they will treat the condition, who else will they consult, and the medical diagnosis. It is everything a medical document should have, readable and understandable even by people without medical training. Lastly, setting up follow-up appointments is often as challenging as setting a new appointment. So Hutano simplifies follow-up care. Clinicians schedule real-time follow-up visits, including appointments with specialists before the patient leaves an appointment. By solving these 5 steps sequentially, in the same order healthcare is delivered and received, Hutano created the first technology to solve healthcare access holistically. At Hutano, we identified that adding time to doctor-patient relationships can lead to better healthcare outcomes. Because seeing a primary care provider is essential, we simplified the process of accessing primary care. Because the average time it takes for a patient to see a doctor has increased to 24 days, we have reduced it to less than 48 hours. Because time spent with patients has decreased to the lowest levels, we have given back providers at least 30% of their time to reinvest in patient relationships. Because healthcare was once believed to be complicated, we have simplified it.